So the number one fear I hear from patients before cataract surgery is, Doc, am I going to go blind from this? And the honest answer might surprise you. Hi everyone, I'm Dr. Todd Driver, a board-certified cataract surgeon in Irvine, California. So this is probably the most important question I get asked in my office. So let's talk about it with real numbers, not just reassurance. So here's the short answer. The chance of going blind from cataract surgery is extremely low. We're talking about a success rate above 99%. The most serious complication, an infection inside the eye, doctors call it endophthalmitis, happens in roughly 1 out of every 5,000 surgeries. And even when it does happen, we can usually treat it and save the vision. Does that mean the risk is zero? No, and I'd never tell you that, but I want to put it in perspective. So here's what a lot of patients don't realize. The complications that keep surgeons up at night aren't the dramatic ones. They're the subtle ones, like swelling in the back of the eye, which we call macular edema, or a slight shift in the lens implant. These things can blur your vision temporarily, but they're almost always treatable. Think of it like this. If a cataract surgery is a flight from LA to New York, going blind would be the plane falling out of the sky. That almost never happens. What's more realistic is a little bit of turbulence along the way, maybe a bumpy landing, but you still get to your destination. The things I actually pay close attention to are infection prevention, making sure the lens is in the right position, and watching for any swelling after surgery. And we have very specific protocols for all of these. So what do we actually do to keep you safe? A lot more than most patients realize. So before surgery even starts, we use an antiseptic solution around the eye. Think of it like hand sanitizer, but specifically designed for the eye surface. During surgery, I place antibiotics directly inside the eye. Studies show that this single step has dropped infection rates by about 5 times compared to a couple of decades ago. The incision itself is about 2.4 millimeters wide, which is smaller than the tip of a pen. It's self-sealing, which means we usually don't even need stitches. And the whole procedure, about 10 minutes. Almost every patient responds by saying, "That's it? That's all it took?" Now here's where it gets interesting. What a lot of people don't know is that waiting too long can make the surgery actually harder and riskier. A very mature, a very dense cataract requires more energy to remove, which means more stress on the eye. It's like the difference between scooping out soft ice cream versus trying to chip away at a frozen block. So in many cases, the bigger risk isn't having the surgery, it's actually putting it off for too long. And if it were up to me personally, if my own parent needed cataract surgery, I wouldn't hesitate. I'd want it done by an experienced surgeon in a modern surgical center with inside the eye antibiotics at the end of the surgery. That combination, in my experience, makes this one of the safest surgeries in all of medicine. So here's the bottom line. Can you technically go blind from cataract surgery? In extremely rare cases, yes, but the real world risk is incredibly small and it's getting smaller every year. So for me, cataract surgery is routine. I've done it thousands of times, but for you, it's a big moment. And I want you to walk into that operating room knowing the facts, not the fear. If this was helpful, please like and subscribe and feel free to drop any questions in the comments. I'll see you in the next video.